Good afternoon. I am so happy to be here with you today. My name's Sheila Hamilton, and I'm the news director at Kink FM in Portland, Oregon. And I'm also a journalist. I've been a journalist for almost 20 years. I've covered stories in film, television, radio, and now print. I have my first book coming out in November of 2015. It's called All the Things We Never Knew. And it's a memoir based on my husband's descent into mental illness. It also provides a really in-depth accounting of looking at the things I didn't know about mental illness and provides some signs and symptoms for other people. It also asks the caregiver question, how much do you give of yourself and how long do you stay with someone before you save yourself? We're going to have the rest of the panel go ahead and introduce themselves.
My name is Erik Kola. I'm a psychiatric nurse. I work at Oregon Health Science University in the Division of Child and Adolescent Psychiatry. I run the collaborative problem-solving project here in the state of Oregon. The alliance that we've formulated here in the state of Oregon is affiliated with Massachusetts General Hospital and Think Kids, which is the parent group of collaborative problem-solving. And really my role has been for going on 8 years now, but particularly over the last 3 years is really expanding the practice of collaborative problem-solving and the paradigm shift in our current culture about how we understand kids with challenging behavior.
I'm Dr. Gina Nichols, and I am the president and CEO of the Foundation for Excellence in Mental Health Care, a community mental health development bank. My background is in clinical social work. I've been an elected official. I've tried to come at this from several different arenas, but most importantly, I'm a wife and a mother and an aunt of people who struggle with mental health issues on a daily basis. Oh, and I also teach at OHSU in the Department of Psychiatry and foster care and,
I'm Ross Zabo. I'm the CEO of the Human Power Project. It's a company that creates mental health curriculum for people of all ages. The company was started in 2013 to really fill a gap, to make mental health more approachable, to make mental health something that people can address on a daily basis, as important as they address their physical health. And I have a long background in experiencing mental health disorders. I was diagnosed with bipolar disorder when I was 16, and when I was 17, my diagnosis changed to bipolar disorder with anger control problems and psychotic features. So I have a lot of experience living it and also being an advocate. I was the director of the National Mental Health Awareness Campaign from 2002 to 2010, and I also wrote a book called Behind Happy Faces.
I'm Jeannine Francolini. I'm the founder of the Flawless Foundation. And the Flawless Foundation's mission is to revolutionize the way that the world perceives, prevents, and treats people with brain-based behavioral challenges. And we're changing the face of this cause. I have my own history of mental illness when I was a teen that I write about on the Huffington Post. We do a lot of blogs. Social media is a really big thing for us to amplify our voice and to get the word out, to take this cause out of the darkness.
All right, I want to begin with a group question. If you could build the perfect prevention model, what would it look like? Erik, can we start with you?
Sure. One of the things that I think, and I took some time to think about this question because I wanted to really, is there a perfect model? I don't know there is, but one of the things that I think it really starts with is information. I think that we have misinformation often in our society that mental health is only happening to somebody else. I think mental health touches us all. I mean, it's a way of thinking about it. And the reality is that mental health is, in the support of people being mentally healthy, is, and very similar to Ross's kind of description, is how we define that as a really important piece. You know, we think about the cost of healthcare dollars in this modern day and age, et cetera, and you think about all the illnesses and everything else associated. There's an underpinning of mental illness in almost anything that we think about in healthcare. And whether you're talking about cancer, diabetes, obesity, all the other factors, including the things that are maybe most current, we have, mass shootings and we have all the other things. Those are really the things that make the global headline news. But if we think about actually the most preventive culture is actually one where if we have the skills early on and we start understanding this from an earlier age, as well as like when we first have children, when we first start talking about it, we can mitigate a lot of those things that are coming as far as healthcare dollars, and we start supporting families and kids rather than realizing that the civil rights issue and the human rights issue of our times are things that are changing, and I believe that we're on the cusp of a very golden age of mental health. I think that we're rediscovering things that we've always known, such as relationship and the core underpinnings of why that's important. I think we all know we're relationally connected. And as we move forward in this and we can actually build on relational capacity and we start sharing information that's more accurate, I think we start moving towards mental health as a culture.
Nice. Gina Nichols.
And I think prevention is such an important key that we don't do very well in this society. We talk about prevention, but we don't talk about primary prevention, secondary prevention, and tertiary prevention. It is so important. Parenting doesn't come with a manual, usually. You get it thrown at you, and hopefully you've had good parenting. But it's very important to have the educational piece, and it's very important to have programs in place, such as Family Building Blocks in Salem, Oregon, where there's a place for kids 0 to 3 for parents to get some help. What we know is scientifically that nurse home visiting works early on. So that part of prevention is very, very important. And I have to tell you what Erik talked about this morning is another key piece. Everyone should have those skill sets, no matter what age they are. That's the base.
Yeah. Ross.
I think one of the biggest things missing is a curriculum. And I think we should start teaching kids about their mental health as early as we teach them about their physical health. We teach them what they should eat, how they should exercise, how they should take care of their bodies. We should also be teaching them tools to actually address their mental health. Right now, we're stuck in a place of reacting or responding to mental health, and we're not being preventative, which is what the question addressed. And so I think one way to do prevention would be to implement these curriculums, whether it's mindfulness from K through 8, or it's high school education, college education. I don't think it should just stop. And I think the key is to normalize mental health instead of isolate mental illness. A lot of quote unquote mental health curriculum is just listing all of the symptoms and disorders that are out there without actually engaging you and helping you understand that you may never have a mental health disorder, but if you're someone who's stressed, who's gone through a traumatic experience, you should be talking about it and finding a way to balance your mental health just like everyone else. And I think one of the best things we could do is teach about coping strategies and give students those examples and those abilities to start managing their mental health from an earlier age until it builds to a point where now it's a crisis and they're stuck just trying to respond to it.
Janine.
What I would add to, I agree with everything that you all said, and what I would add is the recognition that the brain is an organ in our bodies that we need to take care of, we need to be aware of. Brain health is something that it needs to be taught, and we need coping skills and strategies in the same way that we think about our heart or our cholesterol levels or our sugar. And changing the whole paradigm around it, making it more accessible, and taking it, again, out of it being a shameful thing that's a secret, but being open about it.
Jeannine, as part of that, the Flawless Foundation's mission is to try to help destigmatize conversations around mental illness. Do you think that the way the Flawless Foundation goes about it is different than other organizations, other mental health groups?
It's interesting, Gina Nichols was just saying that she thinks we do. You want to take that question? Yes, we really believe that, our philosophy is that we are all one, and that mental health is a continuum. So we all have mental health, it's just whether it's very, very balanced and okay, or more extreme. So we like to celebrate the divinity in every person, celebrate the perfection. Our tagline is seeing the perfection in every person. Coming through this light of and lens of compassion and seeing the strengths in someone instead of the weaknesses and the behavior, just judging someone based on their behavior.
And Ross, your personal story, a lot of people have heard it today, but it's very inspiring. For those who haven't, would you just offer a brief summary of what your roadmap to recovery has been like?
Sure, as brief as I can. So I was diagnosed with bipolar disorder at age 16 and had kind of the classic symptoms. At age 17, my diagnosis changed to bipolar disorder with anger control problems and psychotic features. The issue was definitely bipolar disorder, but I think a bigger issue was how I chose to cope with it. And I started drinking when I was 13 when one of my friends was killed because I wanted to shut down and I wanted to kind of numb out. So by 17, when the diagnosis changed, I was already drinking and formed this really ineffective way to cope. I was hospitalized for attempting to take my own life when I was a senior in high school. And at that time, I wasn't on anyone's radar. I was a president of my class, a varsity basketball player, involved in every student activity. But depression isn't something that cares about what you do or who you are or what you are on the outside. And then it was really a series of hospitalizations in and out of college for the next 4 years. I had to leave college during my freshman year, and then I couldn't stay in college for another 4 years. Eventually, I reached a rock bottom moment where I learned to accept having bipolar disorder. And I think that is a key. If you don't accept having a problem, it's really hard to work on it. I had to work on hating myself as well as bipolar, anger, psychosis, and the alcohol. And the biggest thing I stress, the biggest thing that I've always had to work on and even do to this day, are the coping mechanisms and the emotional regulation that I started at a young age. It was no one's fault that I started hiding my emotions, that I chose to try and make people laugh and hide everything behind a happy face. And it's still something I struggle with, and it's still something I always have to be cautious of, is how am I coping and how do I work on it?
And Erik, you have talked about collaborative problem solving, but I want to know about the impact that it's had on the organizations that are using it.
So this actually, I'm excited to talk about this because, in the state of Oregon, you think about doing a grassroots and to kind of share the idea of the power of one, I think is a way of thinking about this is, and it's not me being the one. I want to really give a lot of credit to the shoulders that we stand on in our lives that actually lift us up. When collaborative problem solving started here in Oregon, it was the vision of a small group of people in the state that actually decided that this siloing of systems that we operate in, and whether you're an educator or you're a parent or you're somebody in the mental health arena or wherever else it may be, too often we are siloing and we are not communicating. And Rita McMillan was a champion here in the state of Oregon in Addictions and Mental Health Division, and she believed in this vision of how do we connect systems of care so that we are speaking the same language and moving forward. And from the very grassroots beginning and really kind of moving towards a framework of compassion and understanding, which was stated before, we've made tremendous progress on starting to have a common language. It is rare in this day and age where I get to go into an educational IEP meeting or a case conference or a RAP team meeting that there's a lot of conventional wisdom that still exists out there that, somebody's lazy, they're not trying hard enough, they're not motivated, or, to Ross's point, I don't think Ross or anybody at this table would recognize that they're a product of their bipolar. He's Ross. And this is his life experience, and this is what he's been through, and we're not a product of our labels. And so collaborative problem solving has really created this common language that allows us to really maintain that compassion and empathetic point of view. And as we've expanded that in the state of Oregon and really had this progressive stance, we find more and more connective tissue that pulls us all together. And so that systems start realizing that if you're in a high level of care and you're stepping down, and all the way along the way, you can actually have this robust, rich, compassionate relational assessment that goes forward. And so, I know we're progressives here in Oregon. I was in New York, and I thought I was going to be this hippie boy that was coming out to New York to train them. But it was really a fascinating thing that we take a lot of risks here in Oregon. But I think they're calculated and thoughtful risks. I think we're on the front end of this, and I think that we're going to continue to champion it moving forward. So,
what are some of the outcomes that you can share?
Yeah, absolutely. So really, I think that this started a little bit out of the idea, and for those of you in the mental health system, and I don't want to pull wool over anybody's eyes, but really there's a national effort to recognize that seclusion restraint rates was where this came from initially. And the reality that we were secluding and restraining our most vulnerable children oftentimes for out of control behavior. And we were, and the idea I always like to put out there is there's no such thing as a therapeutic hold. We use these clinical terms, we're going to therapeutically hold you right now because you're out of control, and we realized the only therapeutic hold is a hug. And we were finding that this wasn't working. So as we implemented CPS, one of the things in the first year, we had a 70% decrease at Emmanuel Children's Hospital in our seclusion restraint rates within the first year of implementing this model. What we found is the patients and the parent satisfaction of them coming out, they felt like, when we came in, we actually ended up with an outcome we were hoping for. We felt engaged. We feel like we have hope again, and we're moving forward. And so we see parent satisfaction, parent sustainability of skills over time, kids' skills over time and development. We see seclusion restraint rates going down. We see less expulsions, summonses, suspension rates. And so we're finding this in all these different systems we're implementing it, and it's really, and I think we're at the tip of the iceberg. The data is just rolling in more and more as we go forward.
That's fantastic.
Yep.
This is a group question. Suicide rates in young people ages 15 to 24 has not increased since 1995. What is it that's working? And then I'd also like you to discuss why has anxiety and depression among people entering college gone up? Janine, you want to go first? Or should Ross go first?
Yeah, I did write a Huffington Post blog about college issues today.
All right.
But I think you have more on the stats around that.
I think what's tough is a lot of times when mental health advocates hear that suicide is the second leading cause of death in college, our initial reaction is like, oh my gosh, this must be so overwhelming, it must be taking everyone's life. And then when you look at the statistics, it was the second leading cause of death in college in 1992. It hasn't gone up. The reason it hasn't gone up as a leading cause of death and even numbers-wise, one is it's much easier to get awareness campaigns and information to people in schools because you can mandate programs, you can put them through things, you can check off a box, you can make sure they hear it. The suicide rate in males ages 35 to 64 has increased, I think, 15% in the last decade. And that is a much harder population to target. It's a much harder population to get a hold of. And so I think we as a mental health advocacy world, we should be happy that we've kept the suicide rate at the level it's at. But a lot of people would argue it is still too many. You lose one life and it's devastating. And anyone who's gone through losing someone, as I have, knows that there's so many what ifs and so many questions and so many hopes. So it is tough. I think you're seeing anxiety and depression reach higher statistics because we're not educating people on what's happening and we're stripping them of coping skills. The conflict resolution skills in the younger generations are statistically lower than they've ever been. And so, of course, anxiety is going to be higher if you don't know how to resolve conflict. And I think that a lot of students today don't know the difference between feeling depressed and having depression. And so a lot of students I talk to will have a bad day and say, well, I have depression. All right, or you had a bad day. So we need to have more education to also explain those things. And I also think there is a normalization right now of having mental health issues instead of balancing your mental
So
health.
you think there could be more reporting actually going on?
Yeah.
Gina, do you have thoughts on this?
I do. I would like to think that some of the reason that the suicide rate has stayed static is that several years ago, Senator Gordon Smith, when his son committed suicide, the Garrett Lee Smith bill was passed that allowed money to go to universities and other schools to help with that trend. And I think that education helped. What it didn't do is address some of the anxiety and depression behavior. I'll give you an example. I was actually at my hairdresser the other day, and she usually talks to me about the mental health of her children. And one of the things that she said, that in high school, it's normal to be on medication because you have anxiety or depression. And kids know to ask for that. And so I think that we have done a disservice to our kids by normalizing mental illness as state of the art, where Flawless is helping to turn that around, where mental health is something that we all need to talk about.
Janine, that's a great segue for you, your thoughts on that, and perhaps how it is that Flawless is actually helping.
So we support a lot of holistic programs, so mindfulness and yoga and trainings like collaborative problem solving. And we're all about looking at what's going on in schools and the work of Dr. Mark Brackett at Yale, the Ruler Approach, which is teaching emotional intelligence. It's a curriculum that starts at K through, yeah. So looking at, all of those kinds of curriculums and teaching it from the ground up and revamping the schools, changing the paradigm to seeing the perfection in every child, to kids do well if they can, instead of you're in kindergarten now, sit down, behave, be a good boy, and don't move, and do your writing.
Right. And Erik?
And I guess the thing that on that, and I really resonates with me what they've already said. I actually was at a mental health forum here in the state of Oregon where we tried to come together because people were trying to differentiate identifying mental illness versus mental health. And I had a gentleman in the audience that actually, this resonated with me, and I think this really goes along the lines of the anxiety and the stressors that we actually currently experience. He said one of the things that we have been in a culture, like through the 80s and 90s, is we've been a very products-driven culture. And even in the 2000s, we look at products, and I think outcomes are very beneficial. But how you get good outcomes is through process. And as we move rather from towards back to a process-driven society, one of the things that our modern-day society does not really support in kind of the structures that we have is process. How do you engage in process? And people ask me many times after my CPS presentation, well, how long does this take? I don't know. It's going to take a long time. I don't have the answer. The process is really where the beautiful work happens, because there's no quick fixes to this. And it goes to the idea of how do you develop coping skills over time, and how do you do this? Where's the time that we're investing in the process versus the product? I mean, the outcome will come if we can spend time in the process. And so when we get anxious and we get stressed, are we spending time in the process of really understanding what people's experiences are?
It's also an interesting thing to understand whether the person is open for it at that particular time, because you can spend a lot of money and energy on a person if that's not the lucky time when they're actually open to hearing the message, you haven't spent your money very well.
You have not.
We need a test for that, don't we? I want to ask this again as a group question, and I hope to get a rousing conversation here, so please don't wait to be called on. Would you medicate your child if he or she were in trouble? Gina, I want to start with you.
Of course you do. Would I medicate my child if my child was in trouble? That would not be the first place that I would look. First of all, I would go to people that I respect. I have a lot of friends that are psychiatrists and psychologists here, and social workers, and I would try everything else first. One of the things we know about medications is some medications work well for people up until 2 years. What we know is after 2 years, most medications, the effectiveness is actually in the negative. So medication would not be the first place that I would start. I always say, because we're human beings, we all can have mental health challenges at any time. So we need to help each other pack our mental health toolbox. And if you have informed consent, and if you know what that medication is going to do, I believe that medication should be a screwdriver in your toolbox and not the jackhammer. So with a child of mine, I would try everything else first.
I don't have kids, and I want to preface it with that because I think it's much easier to be judgy and say what you do with a mythical child. I think. I think that's important to say. I think, when I have kids, if there was a problem, I don't think if this kid had a problem, medication wouldn't be the only thing I try. I think for me, there was probably a part of the heavy meds I was on as a teenager that numbed me so much that I wasn't in as much danger because I wasn't awake and I wasn't cognitively aware of everything. That may have saved me in that moment, but in the long term, everything I did outside of the meds is what moved me forward and gave me mental health and made me who I am outside of the disorders. So I think in my mythical kid, it wouldn't just be meds. There would be these other approaches that they're talking about. But it is really hard, and I do sympathize with families that don't have access to the knowledge and to the people we need to be able to give you other options. When you're stressed out at your job, when you're just trying to make ends meet, and somebody promises you that this medication will help your child, right. I don't fault anyone for going that route because you have this medical professional saying this is what it's going to do. And so I want this question to not be a question of privilege, where people do have as many options to alternative sources as they do to medication. And unfortunately right now, that's not the case. A majority of people only have access to whatever med is being prescribed, not all of the holistic things that we know work.
Your answer also touches on that most people don't prepare their emotional toolbox, and then when they're in crisis, it's anything goes, and so they are taking whatever appears to be the solution, and right back to the whole prevention as key. I want to hear yours, Erik.
And I also, I don't know what to do yet. And I think yet's is a constant word that I'm going to encourage people to add into that equation. And I think that we're in crisis. I think we are looking sometimes for quick fixes. And I think that we want the pain to alleviate and to go away. And I recognize that's a reality. If I'm going to be biased to the model, and kind of where pills don't teach skills. That's the reality of life, is pills are not going to teach skills. What pills can do, and if in medications, particularly psychotropic medications, I do believe that there's a place, but I think it's an informed place. And I think I would encourage you to gather information as a parent to be able to make sure, are you really informed? Do you have all the answers and what this is going to do to the brain? And if you have an informed decision, I do believe medication at times can give capacity and give you a little bit more room to lengthen a fuse, to be able to get an opportunity to be able to, incorporate a comprehensive health plan around your mental health. I guess I'm going to end there.
That's really good. I think a lot of the people in the room today are therapists, and yet we see a lot of kids that are resistant to therapy. How do we talk to them about the benefit of good therapy? And what do you do when a kid is just burned out on therapy?
I'm going to start with that one because I'm pretty passionate about that. I think, as I said before, you call a dog a name long enough and it'll answer to it. And what I was saying earlier in my presentation, expand on that a little bit, is I think there's a good reason that we arrive at a place where kids, as they get older, their ability to access a relational process is already impacted in many ways. Because for many ways, we have often led with the adult concern, and we've led with our concerns as a society, and really that really sacred moment of actually how do you engage a child, it leaves them in a position where there is a lot of distrust. They don't know what you're going to do to them. And I think that it really means when we have a kid that is having a hard time engaging, I have to slow that process down once again, and until I have information and understanding about what that child's truth is or what that parent's truth is, I'm never going to be able to move forward. And so why do you stay in empathy as long as you do in this model? I think you stay there as long as it takes, because as soon as a human being, a child who's distrustful of therapy or engaging with another human being who's trying to do their best to help, because I'll tell you the honest truth, these kids did not choose you to help them. They did not. That is the reality of life. They are placed in your office, and they may have come to you, have been assigned, and they are not choosing you. And so that puts you at a deficit, saying, how do I build relationship? And if they've actually had bad experiences of people trying to tell them and identify, usually therapy is about, here, let's talk about all the things that are wrong with you. That's not really a place that we all want to position ourselves to be in. And so how do you slow that down to be able to say, I'm just trying to gather information and trying to understand. And over time, that validation will occur and relationship will be built. Then you have a platform to be able to expand health.
Good. Gina?
So I have to tell you, I spent years as a therapist, and probably the degrees that did me the most good was my degrees in dance and theater. Because when it came down to children, really staying in that empathy piece, the empathic space is key. It's really key. And I probably did the best connective relationship work with children, putting on a theater program with them, and also teaching kids that had hearing problems to dance. People said it couldn't be done. It certainly can be when you turn up the bass. So that empathy piece, I think, is even if you go outside to play basketball, do whatever the child wants to do. That empathy piece is key. I'd throw the therapy out the window and stay in empathy as long as you can.
Yeah, Ross?
I think the reality is not a lot of people like to seek help for anything. As a male, I rarely go to the doctor even if I'm physically sick, right? So you're telling people to get help. And I agree with everything that Erik and Gina said. And again, I think it goes back to what Erik said. Kind of that education, that checking in with a therapist is making you stronger, it's making you better, it's making you more prepared to handle situations, as opposed to you're going to a therapy because you're messed up, to hear about how you're messed up, to deal with how you're messed up. But I do think it's a challenge, just the act of seeking help, whether it's physical or mental, is not something that a lot of humans seem to want to do. And so, I think it is both things.
Janine?
I'd like to take this to the big picture of changing conventional wisdom. And again, back to kids do well if they can, people do well if they can, seeing the perfect, I want to like hammer that point. Because when you approach someone looking through that lens of you are perfect as you are, you are flawless, that the person responds that way. And I've been amazed and shocked. I ran a girls empowerment group once with some girls that were in and out of psychiatric hospitals and juvenile detention centers, and they would be like violent outside the room before they came in, and then with me they were perfect. They were like angels. We had the best time together, and I said, what's going on here? And I asked them, and they said, they're like, honey, we like so feel the love from you. You're like amazing. We love you. You're like so cool. And it was just, it's like they just need to feel the love. So if you come from that place, I think that people are going to be able to collaborate and to be able to hear and work together on these sticky issues like going to therapy.
That's so good. We met a person last night who described both of her sons' behavioral disorders, and she says, we call ourselves the Flossom family. And I thought, that's pretty good. We might want to just
So
co-opt
good.
that.
I
Flossom.
love that. I'm going to make a note on that.
So Gina, your organization has been instrumental in amplifying some non-pharmaceutical solutions. What kind of projects are you funding currently?
Sure. So the Foundation for Excellence in Mental Health Care's mission is to connect the passion of private philanthropy with the world's top researchers and programs to fund recovery-based projects. We want them in every community. We don't want those projects to depend on your zip code. And so basically we're a community mental health bank, so to speak. And the reason that we don't look at pharmacological interventions is because that's pretty well covered. But looking at the biopsychosocial nature, there's a lot of things throughout the world that are working really, really well. Erik's program is one of them. Open Dialogue from Finland is another one. Hearing Voices from the UK is another one. People ought to have access to those programs no matter where they live. So those are the type of projects that we're funding.
And Janine and Gina, what's the most exciting initiative that you think is happening in terms of mental health policy? Also, Erik and Ross, if you want to jump in on that one as well.
I'd say two people. What's going on with Congressman Tim Ryan in Ohio? He is putting mindfulness. He got $1 million grant for. He implemented $1 million worth of mindfulness in the public schools last year in Ohio, in Columbus, Ohio, and he's trying to transform all of the veterans halls into like spa wellness centers for veterans to come and have massage and acupuncture and mindfulness and yoga. And he's doing a lot of work around food and gardening with kids. So that work for sure. And then Senator Gelser in Oregon is doing some work, and Erik can talk about that a little bit more, with collaborative problem solving in the schools as well, to help to support the suspension rates and what's going on.
And I'll just kind of add on to that. One of the things that people should be aware of too, and I think this is really an important shift in our educational culture, is really recognizing that many of the major school districts in the country, including Los Angeles as well as New York City school system, are moving towards, and LA actually just in the last 9 months has actually moved to a no suspension and exclusion policy, okay? And so we're starting to move away in the fact that we have kids in, you know, this very rich environment in an educational system, and expelling and suspending kids, we're finding that was not durable long term. New York City is moving in that direction as well, right? Just had an opportunity to go out there and speak to a bunch of the New York City's finest police officers. There's also a lot of work, and to start Sarah Gelser's initiatives that are going on here too. There's a lot of early childhood investment, and I think Gina kind of referenced this. When we get preventative and we start working in early childhood classrooms with early childhood educators, we have this rich social emotional curriculum that offers the coping skills and awareness of how do we define mental health. So we have a lot of these things happening, not only in our educational, in one aspect is in our educational system. Yep.
That's really good.
Yeah.
Ross, do you want to jump in on that at all?
I think the biggest thing, I'm in another life, I'd be a neuroscientist, and I think, you know, we've learned more about the brain in the last 5 years than we did in all the years before it, and I think that's going to be the trend every 5 years from now until who knows how long. And so I'm most excited about neurobiology locating the neural connections that are most at play with what we're labeling mental health disorders, because I think that's going to lead us to an exciting place of really trying to be able to better identify and how to help balance those things, which is a great time to be alive and see all that data coming out.
That's good. Gina, any thoughts?
Yeah, I just wanted to add on to what Janine said. I agree with all three of you, and certainly Senator Ryan is doing some amazing work. We have donor advised funds within our foundation because we're like a community mental health foundation. And one of the funds that has been opened is exactly to help Senator Ryan do this. And so we have a colleague out of the University of Massachusetts that is on the forefront of a lot of these things, helping to put mindfulness in schools. And I'm so glad that Senator Gelser here is doing the same thing with collaborative problem solving. There's a curriculum called Mental Health First Aid that a lot of you may be familiar with. I helped get that instituted in Oregon about 15 years ago. There's another curriculum that adds on to that called Emotional CPR. And the city of LA has taken it over lock, stock, and barrel. And again, it's a way to teach everybody, you know, what CPR is. What about emotional CPR? Same thing. So the educational piece at an early age.
And the toolkit that Gina's referring to right now, the TriCounty Area is offering those kind of classes free at their website. We have the link up at Kink FM if you want to sign up for one of those classes. They look like an extraordinary way to get educated. Incredible. So the final thoughts for our group: if I were in charge of mental health policy in America, I would blank. Erik. Erik's
I'm
going to
start. You know, one of the things that's resonated with me for years is I think that there are things that we can learn without reinventing the wheel. And I know that Sweden is an example of this, where when they address mental health concerns in their community, that what they do is they treat the whole system. And I think that one of the things that we sometimes do is we partition systems. And so when a family is recognized, and if I had policy to support this, I would recognize that the support of, we have maternity leave and, you know, Family Leave Act and these other pieces, that the ability to support families, that when you have the demands of a 40-hour-a-week job and your other 40-hour-a-week job is raising a child and other things like this, and there's crisis, in Sweden what they do is they actually take a leave to where they actually have places for people to go as a family for a period of time to kind of generate this growth that is necessary in skills. So the idea of actually how do you create the space for people to do it. I think policy is about space and resources to where you can actually put a pause button on life for just a minute. I know it's never easy, but how do we do that to support families? Because we can just kind of, hey, hold your bootstraps up, suck it up, keep digging, find more resources, and I don't think that that's working.
Gina?
I would agree with that. We also have a fund that was created, since we're in a national foundation, created by Sweden, called the Empathy Room, and it's basically to build that. Now you have to remember that Sweden has about 42% tax structure, and so some of their, you know, they pay for what you get, but you also get a year off when you have a child to make sure that they get a healthy start. I think that we need to start making some really serious decisions here in the United States about how we value early childhood and life. And it's really hard to take a person that has been damaged by a trauma and turn back the clock. It's better to start that healthy foundation, and I'm hoping that some of our policies will be going that way.
Yeah. Ross?
I think if I could control policy, I would start building more mental health treatment centers than jails. Just that. The largest mental health treatment centers in the country right now are jails. It's interesting when we talk about tax code. I pay 40% taxes. When you factor in my state and federal, where does it go?
Yeah.
To jails. And it's not going to help people. It's not going to a proactive thing. I don't even make a lot of money. You know, when Warren Buffett realized that his executive assistant making $60,000 a year paid a higher tax percentage than he paid.
Yeah.
We need to be smarter with where we're spending this money. And we've built more jails in this country in the past 10 years than we've built schools in some states, and certainly than we've built more mental health treatment centers. So that's where I'd start.
I would reform the educational system. I would create schools that were conducive to brain health, So there would be small classes, relationship with the teacher would be really important. Kids would stay with their teacher for more than 1 year. They would have lots of exercise and breaks, and it would be developmentally appropriate instead of sitting in chairs and trying to fit into a box that works for only a few of the kids, a small percentage. And I would completely train all of the teachers in collaborative problem solving, in the ruler approach, and I think that would be a perfect world.
Flawless approach.
A flawless world.
We have a few questions. Wonderful. That the audience has submitted. I'll begin with this one. Thoughts or suggestions for addressing systems change for youth with mental health challenges being separated from average functioning peers? How do we promote belonging when environments are promoting otherwise? Great question. Erik?
Oh, there's a lot to that question. I want to make sure that I can answer it effectively.
Speaking about kids with mental health challenges being separated from average functioning peers, what do we do? How do we
Well, I think our
address system
solution
change?
is to separate them. I think that you know, remember at the beginning when we were talking and during my piece, your understanding guides your intervention. If your understanding is off, your intervention is wrong. I think isolating and excluding kids into environments that are not part of community connectivity, you know, the reality is this. We actually have relational poverty in our culture. And what I mean by that is if you go back, you know, 3 or 4 generations, people were raised in homes and connected that, you know, we live in a very diverse culture in other parts of the country. And so you have an aunt and uncle that live in Illinois, and you have people, grandparents that are here. We are so divided in some aspect that you know, if you have a single parent home, you're really struggling to be able to make sure you have the relational richness that you need. And so one of the things that I'm worried about is, one of the things we need to do is actually how do we formulate, and this comes from a different perspective called multisystemic therapy, but really understanding how do we create all of the community partners, and whether they're church leaders or they're community leaders or whatever else, because there can be surrogate family. We want richer relationships, and I think that if you understand that it's a relational poverty issue, then you will find that your explanation, if that's it, then what our intervention is not to exclude these kids, but to actually embrace them and bring them in. And so I think that's one way of kind of engaging systems.
I couldn't have said it any better. I agree 1,000%.
Okay.
And Ross?
Yeah, I agree with that. I mean, there's more to expand on, but I think that's the best answer.
All right.
And Bruce Perry talks about, in terms of relational poverty, that I think, I don't know the exact stat, but that in the times of hunting and gathering, we had 15 more adults in our lives when we were born. We lived, I think it was 15. Do you know that stat
along those lines, yeah.
Bruce? So the language stimulation, emotional development, attachment was all expanded in a massive way. So thinking about relational poverty is so key, and back to what I said about school, and they're really scarce environments in terms of emotional.
And you had aunties to
Lots of
Right.
aunties.
help you out.
Yes.
You know, there was Lily Tomlin actually had this great quote, and I think this is where we start, bringing people in. And she said, I looked at a problem like that and I said, someone should do something about it. And she goes, then I realized I was someone. and the reality is as we're all someone, the relationship that you're going to connect to, you can be the one. I mean, you may be the one person in that kid's life that they lean on. And I think that the power of that one person is pretty impactful over long term. And so how do we do that? Include them in, embrace them. You know, I try to teach my kids every day that kid that's on the sideline watching everybody else because they don't know anybody, the best thing you could ever do is to go up to them and say, hi, my name is Mason. That's my daughter's name. And say, and what are you doing? And you want to join us? Because that inclusion is where healing and relationships begin.
How can a family best support a child who is 16 who does not want to take medication or therapy for their mental illness? Gina, that'd be a good place to start.
Don't make them take medication, but help them to understand what all their options are and why they may be feeling the way that they are. Again, I go back to collaborative problem solving, that empathy. You talk about times that perhaps that you may or may not want to have taken medication for any number of things. But again, have a relationship and not a thou shalt. At 16 years old, they need to learn to make choices for themselves. And if they don't know that yet, that's a perfect opportunity to talk to them.
Ross, do you see any differently?
No, I think what's tough is if someone doesn't want to take medication or go to therapy, but still admits there's a problem, then there's things you can do. If they don't want to take medication or go to therapy and they don't think there's anything wrong, but they're clearly exhibiting all of the symptoms that something's wrong, that's a little bit harder place to be in. And in that place, you have to talk to them and try and find out what are the barriers to them actually accepting or admitting that something's wrong, and try and see if it's coming from a place of weakness or embarrassment or fear or shame, or do they feel stupid, or do they feel like there's no hope, and address those barriers, because that's just a different paradigm.
And the reality is that ability to say, I'm not taking medications, I'm not going to therapy, that's the kid's best solution to a concern that we don't understand yet.
Exactly.
We still have a lot of work to do to try to say, there's a good reason. There must be a good reason why you're not taking your meds. There must be a good reason why you don't want to go to therapy. Help me understand that, and then we actually get some traction.
Janine, anything else?
Well, what I agree with everyone, and instead of repeating what they said, what I'd like to talk about is offering a tool for how to handle that as an adult, dealing with it. That's a very, very challenging situation. So being mindful of your own triggers and your own, having a way to stay present and to not, it's very frustrating. So that's just the only other thing I would add is really being in check with your own self-care, your own emotional regulation as you step into conversations like that, where you're really going to have to hold space and come from a very loving, unconditional acceptance spot.
This one is really interesting to me because I just was talking with a friend who has gone through almost 3 months of trying to find a good therapist, and they're at wit's end because it's just not working for she and her child. So many organizations, individuals put themselves out there as helpers, but they just do not seem to help. Telling people to seek help, even professional help, has been a very long, decades-long disappointment to me and my child. This is a big one.
Wow. Well, one of the things that I actually know is that experience is actually the experience of a parent. I'm humbled sometimes. I've been working in mental health for 22 years now, and I can talk to parents who have, through fire and through everything else of learning a complex mental health system that is oftentimes kind of hitchy, doesn't really work, it's convoluted, how do you navigate your way around this? I think parents and peers can be some of the best advocates to guide your process. And I would encourage you that, I can be a mental health professional up here and I actually have some experience, et cetera, but I don't have all the answers. And I think that when we can find families that have been through that, and Swindells is a great example with this, Flawless, and other organizations, reach out. And I think this is the biggest piece, is that if you're feeling isolated and you feel like you have not found the right fit, you have not attuned just the right thing that meets your needs as a family and for you and your child, I think I would like this, is please don't get back to where we talked about like this. That's a really loss of hope where your hands are in the air. Reach out, try to find somebody, access it, and somebody will help guide you in some aspect. I'm not going to give you the answers. I'm not the guy to give you answers. I'm here to to understand your questions and say, how can I put the resources in front of you so you can make the decision that's best for you.
Erik, before everyone
Sure.
answers, this follow-up question is, again, from the same person in the audience. It was acknowledged that the weight of having to implement consequences is heavy on parents, especially those of us that are fatigued.
Yes.
The CPS method feels even more inaccessible to us as tired, overwhelmed, and exhausted parents. Is it actually implemented by normal people?
Yes,
wow.
What a great question.
Wow.
Am I not normal? Is that what somebody's saying? No, I'm just kidding.
Wow.
So this is the reality of this. And I know that we're coming, and I actually, in a 2-hour presentation, the ability to put the tenets of the model out there, it's quick and it's fast. I'm trying to be able to get the overarching kind of concepts of what goes on. The collaborative problem-solving model was not developed for clinicians. That's the bottom line. The reality is it doesn't, as Ross was saying, it does not require that you have a PhD, a master's degree, a high school diploma, or anything. It requires that you're a human. And the reality is that the explosive child and the underpinnings of kids do well if they can was originally designed for parents. Because parents were out there saying, I don't know what to do. And when your tank is empty and you have to get up every day, and the resilience that it takes to get up every day to continue to support families and kids, that is a tough job. And I am humbled once again by the efforts that people make, because I don't think it's a lack of trying. I don't know anybody who's trying harder than families and kids that are miserable on some level to not be miserable. And so how do we end up this? Yes, it is accessible. It takes time though. There's the great thing about collaborative problem solving requires really rewiring some neural pathways and how we see kids and families. And that's going to take time. This is a 2-hour presentation. If you're interested in learning more, it's a skill development like any good skill development. You can go to the best training in the world, but if you do not get some support and skills development and repetition and practice in it, the skills will never take hold. And so it's about repetition, it's about time. And so engaging and finding, here in the Oregon, we have a lot of tier 1 trainings. Please, as a parent, come if you want to. It doesn't have to be a clinical, you don't have to be clinical to come to a tier 1 training. It's 2.5 days, and we will get very, very deep so that when your tank is empty and you are actually in those moments where you want to throw your hands up in the air, people do well if they can. My kid would do well if they can, and so would I in this moment. And so what do we need to do, and how do we start understanding? Initially, too, I would tell you this, to follow up on that question. You will find that over time, initially there's a lot of upfront effort that's going to come in collaborative problem solving that's on your end. You're saying, oh, you're going to add more to my plate? No. But this is the reality. What you're hoping for is that you are the surrogate frontal lobe for now. But over time, what's going to happen is as your child develops skills, they will actually become less dependent on you to problem solve, be flexible, adaptable, and handle frustration, and your ability to have access to continuing to maintain your own mental health is important. This month, last week, there was actually the Children's Mental Health Conference in Salem this last week. And the child, or the young man, he's not a child anymore, that was honored is the son of a dear friend of mine named Chris Anderson. She works for the Oregon Family Smart Network, or did historically. But she wrote me a letter when he was 13 that she thought her son would be dead by the time he was 15. Happy to say that he graduated from high school with a standard diploma last year, and he is a complex kid with a lot of difficulties. But they, similar to Janine, the ideas of how we do this, and is it easy? No, it's messy. Relationships are messy. But actually now Chris loves this because she sits there, and we'll be in moments where we're a hot button issue in the household, and he knows the model well enough now. He says, hey, Mom, I don't think you're staying in empathy long enough here.
My son does that too. He's like,
Yes.
Mom, that was not collaborative problem
That was
solving.
not clever. And so the ability to create that
It's
structure, which
amazing.
goes along Ross's
Amazing.
lines of how do you create these abilities to have these structures that you can operate from. It's great. And then it's not all on you. It shouldn't all be on you as parents and everybody else. It's a starting
Gina,
place.
your thoughts about that? Do you need the original question?
No, I can go back
Okay.
to the original question
Yeah.
because I've been thinking about that in my mind, and I think that's really important because I actually get asked that question at least a couple times a week.
I'm sure.
And remember, we're just the community mental health bank. We're a community mental health foundation, and so that's not what I do anymore, but I used to do that, and I know Oregon very, very well. So one of the things that our foundation is doing is actually in the process right now of building a resource directory, one that people have to sign off on, that they believe in the recovery principles of treatment, and they have to come with 2 recommendations, etc., just so we can build a resource directory where people can go to and find resources. So that's an aside. But probably more important is attending meetings just like this. We have to figure out a way to not discriminate against mental health challenges. And we do that by being real. The Flawless Foundation, the Foundation for Excellence in Mental Health Care work hand in hand to take that discrimination and make it a thing of the past. And we've done that in a lot of different arenas. And mental health is kind of like the last frontier. And so you're all part of that, solving that problem. So people know where to go because it's out in the open. So it's a journey, and thank you for being on that journey with us, building that.
Ross?
Yeah, the only thing I would add, I think that's a really important answer. 10 years is a long time, and to whoever wrote this question, I really feel for you. The system's not set up. It's not easy for you. I can understand how collaborative problem solving would seem like this extraneous thing that isn't for normal people. It sucks, and it's really tragic to hear that 10 years has gone on, and you're not alone. I hear from people like that all the time, and so that's why I think Gina's answer resonates so importantly, is we need to let people know what options are out there and not discriminate against whatever the situation is. And I just hope you'll keep trying and you'll keep accessing whatever you can, because it's really hard to be in that place.
Never give up.
Ross, this question is first to you. Do millennials stigmatize mental health disorders like previous generations, or are they better at it because of social media? And what is the role of social media?
That's a lot of questions. So first of all, the stigma has certainly gone down. in millennials. It's not as high as it was. It's hard to capture that because a lot of times when we capture, it's hard to measure stigma. Because in a pretest, who says they're stigmatizing, who says they're the racist, who says they're the sexist. It's hard to capture it in data. But just anecdotally, the stigma has certainly gone down in millennials. It hasn't necessarily gone down in a great way, because now there's this celebration of having a mental health disorder. And now there's a normalization of being stressed out and having more therapists and who can be more messed up. And so it's gone down. There is the element of normalizing the competition to be stressed out and who's messed up. Social media, also great and bad. You can cite all of the stories of someone who posted on social media that they wanted to take their own life and their life was saved. And then you can post all of the stories of cyberbullying and the kids who took their own lives because of being cyberbullied on social media. So it's like, I think the best thing I can say is that social media has given people an outlet that normally wouldn't speak out. It gives them that anonymity. It gives them the courage to share it in a format that they may not have had ever before. But they do have to get out from behind that computer at some point. They do have to get out from behind that social media and actually share it in their real life, or it's not going to have that lasting impact. It's just like anything. If you want to build those neural pathways, it can't just be done in one avenue. So as a parent or as somebody, you shouldn't be afraid of social media for your kids, and you shouldn't be discouraging them from it. It can be a great tool, but it's also good to have them practicing those things offline.
This is a fantastic question. I read The Explosive Child in the following book, but this lecture seems to have a lot more information than those books. What other books do you recommend to reinforce the knowledge that was given today? Favorite mental health book? That's a good one.
Bruce Perry.
Dr. Bruce Perry.
Yeah, Born for Love.
Born for Love, or The Boy Who Was Raised as a Dog. Those are both two great books. I would also recommend Dr. Dan Siegel's work as well.
Yes.
I would agree.
I would recommend The Brain That Changes Itself.
I would recommend Behind Happy Faces. We have time for one more question, it appears. All right, this is kind of for you, Erik.
Okay.
Does the CPS approach assume that behind every problematic behavior there's always a trigger toward which to drill down? What to do when there may be no emotion or dynamic or trigger behind that behavior to discover, for instance, in the case of a child with Tourette syndrome who sometimes has involuntary tics, which are also problematic behaviors.
Right. And so I had an opportunity to actually talk to the person who put this question out there. And so when you have something, in the frame of kind of what we're talking about, is that Tourette's has an impact somewhere. And I think that it's really about when you have something that you may not be able to drill down that there's a particular trigger because it's an involuntary response, that I would say this. What I'm probably more interested in is being able to still do a contextual assessment of what context does this create challenges in? And that's something where I'm going to spend time from a collaborative lens, being able to say, an example where if you are, with the Tourette's, that you're striking out at people, not because of volition or intent, but because of the Tourette's, that one of the things that I'm interested in is saying, how do we begin to understand what it means for that person and what the life picture is going to look like? Because I would still engage that child very much in the same way of saying, well, this is the situation and there's no intention to hurt your sister. So what are the situations where other people are around you that this might have an impact on? Because I don't want you to feel bad and offer a lot of reassurance, but how are we going to figure this out? And what do you want to do in situations in your life where this might be a factor that's at play? And I'm still really want to look at it from the lens, once again, without stigmatizing and labeling. Kids do well if they can, and kids with Tourette's, they do well if they can. And what does that mean? But what does it mean and the impacts they have in their life? I'm going to spend my time on assessment there and asking those questions, and I'm not going to solve the problem for them. I'm going to engage with them to be able to say, what do you want to do about this, and how does this look for you? And this is your life, and I'm here to help you come up with answers together. So that's probably how I would approach it.
And Ross, a final question for you. What's the mental health community doing to try to get educational institutions to teach future teachers about mental illness?
Not much. There are a lot of organizations that are trying to get into institutions, universities and colleges that specifically teach teachers to add elements of curriculum to help them, as part of their degree, understand the mental health challenges that their students may be experiencing and how to address it. But as you can imagine, it's a hard fight, and I think a lot of organizations right now are focused on so many other things that there are some organizations that are working with universities and colleges to implement it, which is great. But I don't know that it's a priority of a lot of organizations right now.
When I'm president,
It's all gonna change.
every education school will have collaborative problem solving and the ruler approach in the curriculum for the teachers.
Jeannine Francolini, Szabo, Gina Nichols, and Erik Kola, thank you so much for your time today.
Thanks.
Thank you guys.